Action today in the federal court as a West Virginia coal miner sues the federal government for potential program cuts to the National Institute of Occupational Safety and Health.
Our Bailey Tucker spent the morning in court as a federal attorney trying to get the lawsuit thrown out. And Bailey, what arguments did you hear?
Gina Payton, many of those in court today spoke passionately about the work NIOSH does and how the lives of coal miners have been saved because of it. They say without it, the death rate of those mining coal could potentially increase. Kanawha County coal miner Harry Wiley was diagnosed with black lung last November and is still working underground where the severity of his condition could get worse. He's filed a lawsuit with the federal government who has been cutting positions at NIOSH, somewhere that could help him with the resources he needs to get better, according to his lawyer, Sam Petznick.
Many miners use their federal right to transfer away from the working face of a mine once they begin developing black lung so that the disease doesn't totally disable them and kill them. That transfer program is what the government has shut down, and along with the medical tracking services that go along to inform miners when they are getting sick.
But in court Wednesday morning, Fred Westphal, who was representing the government, argued that these worries were premature. On March 27th, the U.S. Department of Health and Human Services issued a press release saying, quote, "Today, the U.S. Department of Health and Human Services announced a dramatic restructuring in accordance with President Trump's executive order implementing the President's Department of Government Efficiency Workforce Optimization Initiative." In April, West Virginia Senator Shelley Moore Capito had confirmed that the agency would be keeping some of their functions for coal miner and firefighter safety. But over the weekend, more cuts to the organization were announced. NIOSH is allegedly supposed to merge with several other agencies and be called the Administration for a Healthy America. Petznick and his team think differently.
We just disagree with that because it says on their website you can't file a transfer request, you can't submit x-rays to us right now. So the government is telling people in the wider world that the program is shut down.
Several NIOSH employees who testified this morning all said they were unaware of any merger, but felt that their jobs played an important role when it comes to saving the lives of miners.
No miner should come down with black lung to begin with. But when those systems fail our miners, NIOSH is a backstop. NIOSH is a way that miners who do become sick can transfer away and minimize the damage to their lives.
Judge Irene Berger, who oversaw today's hearing, says she should have a decision made soon on whether or not the lawsuit will stand. We will update you as soon as we know more. Live in the studio, Bailey Tucker, Eyewitness News.